Hello, this is Dr. Holmberg from Holmberg Wellness Group, and we are going to talk to you today about inner segmental traction. Some people call it roller bed, but what we use this for in our office is to help people get more range of motion and get their backs moving better. In other words, a lot of people that come in the office, their backs are really stiff, sore, tight, and so they want to get their pain to go away. Well, that's true, and we want to accomplish that, but we also want to make sure that as we're doing that, we're increasing range of motion. Now, most people, unfortunately, during their day, sit a lot. They don't get to use their muscles as much as they like to, and therefore their muscles get tight, sore, stiff, but also their joints, specifically in their back, get tight. Now, what we want to know is that in most people's backs, when they're sitting, they have 60% more postural stress than if they're standing or walking. So it's very important to recapture that with the what we call roller bed or intersegmental traction. Now, intersegmental traction is a little bit different than the normal traction that we hear about in the fact that when this machine works on you, what it does, it works on individual bones. So it glides the joints to and fro adjacent to them or next to them to capture more range of motion and, more importantly, imbibe or bring in more fluid into the disc. The disc is the part of the spine that actually helps absorb shock. Well, if that disc starts collapsing or getting smaller, the bones get closer and closer together, causing more stiffness. So this machine helps to gather more fluid into that disc to help get more flexibility and range of motion in the spine. Okay? Now, when we do this, we usually do this for about 10 minutes, and the person that receives the therapy usually lies on their back. There is one thing that we make sure the person doesn't have, and that would be rods in their back. Now, a lot of people, because they've had really bad scoliosis or curves in their back, which go like this, then what happens is the doctor, if it's really bad, or what we call severe scoliosis, they'll put rods in the back to stabilize those structures. Unfortunately, with that type of procedure, we can't have them lie on the bed because as it rolls up and down the spine, it could put too much pressure on that rod and cause problems. Okay, so keeping that in mind. So what I'm going to do is I'm going to show you how this machine works. Ready? So the person receiving the traction or the intersegmental traction lies on their back. Usually put their head in a pillow to relax their head and give it some comfort. Then what we do is we put a pillow below their knees, which allows the spine to straighten out. This allows the rollers, which roll underneath here, we're going to show this in a second, to get more pressure up against the spine and provide more relief. There's various settings on this machine. One is the time, and like I said, 10 minutes works just fine for this. Now, depending on the person's stiffness, tightness, and maybe their level of need of care, we can also adjust how much or how high the rollers come up on the back and basically push the back up into the air. This provides more traction, but we have to be careful in how much we provide. And so on this particular person, we're going to go midway up. And you can see as I push up, it provides more push to the spine and creates more almost like a wave effect in the back as it goes up and down. Okay, is that enough, maybe? We can also control it. It can go this way back and forth. It can go this way back and forth, depending on what we're trying to accomplish. Now, if it's more in the lower back, the area that we're trying to get more range of motion, we want the ball bearings or the rollers to roll more towards the feet, applying traction towards the lower back. Conversely, if there's tightness in the neck area, we'd want to have it rolling more towards the neck. So there's just some different options on that. It's good, Mandy. All right, you may stand up. It's good. A lot of times with chiropractic, we may even do this just to increase more range of motion before the adjustment. And so this might be done before an adjustment or a manipulation, a chiropractic manipulation, where we adjust the spine to increase more range of motion. So, just to point out what this machine does, it basically goes up and down the spine, applying pressure up and back in the spine, creating a vacuum effect, which helps, like I said, bring more fluid in the disc, and also helps to get more motion between the joints. Okay, and it can roll up towards the neck or down towards the lower back. There's 24 vertebrae in the spine, and this helps to regain the range of motion we want in those vertebrae. I am Dr. Holmberg, Holmberg Wellness Group. I hope you learned quite a bit about intersegmental traction, and we look forward to talking to you next time. You can find us on the web at holmbergwellnessgroup.com.